When we talk about anesthesiologist, I think each one of us should be proud to be called as anesthesiologist because this is a stream wherein you have a lot of involvement, wherein the perioperative management brings about the patient safety, bring about care of these patients coming for various procedures, whether inside the operating room or outside the operating room for various NORA procedures, and even for critical care setups, the pain medicine, the palliative medicine, and each one, the central figure would be the anesthesiologist taking care of that. And I think each one of you should also be proud that it is a multitasking. And I think the anesthesiologists are especially privileged one, and by their training, they become multitaskers. And they do multitasking without getting annoyed, without getting brain clogged, without getting any frustration, and they are able to do it effectively. And that's the difference between an anesthesiologist physician as compared to the other specialty, and they do so effectively. And this calmness, non-panicness, multitasking, taking care of the patient safety, I think this is what the skill of an anesthesiologist is, which is bringing him to the platform where they are being given not only an academician post as a researcher post, but nowadays a lot of administrative post is also held by the anesthesiologist. And this skill, by virtue being called as anesthesiologist, is actually which we need to empower ourselves from the beginning of the training itself. And when we try to empower the anesthesiologist, we need to understand that what all skills are required for a person to be called the empowered anesthesiologist, because we have to provide a safe perioperative care, but simultaneously we are a leader in the OT, we are a communicator in the OT, we are innovator in the OT, we are educator, and we advocate for patient safety. So this means the whole healthcare infrastructure has a major contribution from anesthesiologist. And that's why the true empowerment comes not from position, but from multi-dimensional growth. And hence it becomes essential for us to make us grow by understanding these skills, which is the basic, you can say, nature of an anesthesiologist to acquire to become a leader. And these skills are many skills, but I will try to take you through some of the important ones. The skills include the clinical and technical skills, the decision and critical thinking, leadership and teamwork, communication skills, leadership and adaptability, well-being and emotional resilience, and management and administrative skills. This is what we need to acquire for many purposes, but definitely to provide safe perioperative care to our patients. Let's see the first skill, clinical and technical mastery. Yes, it is our first objective of professional degree that we hold. It becomes essential to provide best perioperative care to our patients, and hence there is no confusion that we should master our own stream, that is perioperative physician, which encompasses the perioperative care and the intraoperative care as an anesthesiologist. And when we say the clinical and technical mastery, which is from the understanding the knowledge, but also the procedural expertise. And this is what is important, because when you're getting a case done, it's just not the pain management or the airway securing, but if you get involved into the patient management, we have been doing at our Onco Center, outcome of the patient, even the surgical outcome of the patient, depends upon the anesthesiologist caliber. And this is very essential. Say as simple as if a patient is undergoing an abdominal surgeries with multiple bowel resection and anastomosis, any chance of hypotension, hypoperfusion, interlactates can lead to bowel dehiscence, and that will lead to poor surgical outcome. An anesthesiologist can play a major role in the recovery of the bowel anastomosis also. This is not just an surgical anastomosis. This also requires you to have good perfusion of that anastomotic site without happening of local edema or local metabolic acidotic milieu at that site, because it will have impact on the surgical outcome. And this is what anesthesiologists can do. We say that the surgeons will do anastomosis, if it dehiscence, it's their problem. But we can take a leadership role here by showing a knowledge and technical mastery of giving a good surgical outcome by providing a good anesthetic care into these patients. And how can we come up? I've just given you one example, but the other examples will be the advanced airway techniques. When we say advanced airway techniques, we have to use it. We are expert in fiber optic scopes, Once you take a leadership role, when you have a technical mastery, as happens in my operating room, sometime a surgeon will say, Rakesh, can you just show me the site of your tumor, how big it is, how far it is? Will I get a safety margin for pneumonectomy or lobectomy? Now, I'm not a pulmonary medicine specialist, but I have learned the advanced airway techniques well. So I do show them various surgical things to them for their better resection. And that's why I take a lead there. Same as the regional anesthesia blocks. Same comes with perioperative ultrasound. Why not to go into the post-operative period in a major surgical procedures and do a DVT scan? Your surgeons will be happy because in those situations, if it is happening, then these patients will be better outcome. They get a pulmonary embolism in a post-operative period surgical ward. We say maybe it's a perioperative complication, but if we can do it, they become so happy. And that's why if we gain competency in these clinical and technical mastery, which is essential for us to acquire not just for the anesthetic management, but also to become a team leader and to get a good faith, confidence of the team, and they will start treating you as a leader in the operating room. And that is what we are looking for. Examples will be many more also. Say, for example, a morbidly obese post-radiotherapy patients arrive for thyroid surgeries. Your surgeon says stressed up. Your radiation oncologist is stressed up. Sometimes we happen that in the radiation oncologist suite or in the CT scan, they collapse because of the airway edema. If you secure the airway well, they become so happy that their patient has been saved by you and they treat you exactly like a leader. Similarly, a trauma case with rift fractures. A trauma surgeon will look for a patient is not breathing well, put up a ESP block and patient is breathing well and surgeons become so happy. Similarly, the regurgitation in emergencies, appendectomy, or a small pediatric patient with syndromes and you are able to manage it, your pediatric surgeon becomes a fan of you. So this is what we said. If you have to learn your clinical and technical mastery, you will have a self-reliance. You will be able to manage without panic. You will have credibility and people will give you leadership role. There will be fewer complications and you and your team, even the surgical team, will feel proud that the complication rates are less here. And this is what will make you leadership. This will empower you by learning this clinical and technical mastery over time will make you a more popular person in the team to give you a better visibility. And that's the reason we should learn this clinical technical mastery by experience, by attending workshops, by listening to the doyens in these fields, and then attending workshops and regularly rehearsing those things, and definitely by teaching others, because when we teach others, we also learn a lot. Now, in continuity, this another skill which is important for anesthesiologists is decision-making and critical thinking. In anesthesiologists, many complications happen suddenly, and we have to take a decision at that moment of time without thinking much, without having resources or going to some other place and discussing on literature. No, something has been done absolutely at the point of care. If the aorta ruptures, IVC ruptures, there is a major trauma, pneumothorax happens, tension pneumothorax happens, you have to take a decision within minutes, sometime within seconds also. And this decision making becomes important. And this requires your background knowledge and experience and critical thinking. So as an anesthesiologist, again, this skill is very, very important for you. A quick and correct judgment under a pressure, under sudden unexpected event defines the caliber of anesthesiologist. And that's why if you empower yourself with these type of handling the clinical situation, critical situation without panicky and takes a correct judgment, I think that is what makes you a leader for you. A confident decision maker becomes the voice of reason and becomes a leader when the others panic. And this is what we anesthesiologists should take it forward. When we say decision making and critical thinking, this is not just a single point of interaction. We have to develop a habit of critically thinking of a patient's management. We should practice risk assessment, ICU scoring systems, predictors. If I'm getting a case done, I should be knowing that this case may have airway related issues. This may have breathing related issues. This may have maybe by the surgical. When we look at the CT scan, we see that there's so much involvement of the peritoneum with metastasis. We know that this patient is going to bleed heavily intraoperatively. And if you are prepared, this will help you to make correct decisions. This will help you to take critical thinking. And that is what you get involved into the patient management. And this skill is important. Moment you get involved into the perioperative patient management, your outcome improve. And if you stay updated on evidence-based perioperative practices, obviously you remain latest. That's why listening to the new guidelines, new evidences becomes important. Indian Journal of Anesthesia recently has been published a lot of meta-analysis. Guidelines has been recently published. Now, by reading these, by updating those things, it becomes very important for you to update the latest evidence so that you can take a correct decision making. And this skill, empowerment, is very, very important for you to become a leader. And once you are able to take decisions, you will be participating in discussion and clinical audits. We have tumor boards with us. We will be discussing patients which are difficult patients, and we'll be in a team taking decisions that we have to manage this. And our surgical colleagues will come to us that, Rakesh, this patient is this problem. We will have a difficult surgeries. How should we go about it? Now, this participation and discussion makes you a leader. But yes, because you are able to take decisions and critical thinking, because you are involved into it. This skill you have developed over time, acquired over time, and now you can take critical decisions at right time also. And this type of decisions in a high-risk patient becomes important. Examples will be patients like COPD, obese with OSA, patients with having, say, the recent, when we say the delirium, we say benzodiazepines are not good to be given them as pre-medication because they have a delirium. And say 60, 70, 80 years old patients coming knee surgeries, why to give midazolam or diazepam for these patients? Because they can go into delirium. If I can manage without it, good. These type of updation, if you give it, your patient will be fully awake. Your chances of post-operative cognitive dysfunction, recently we published meta-analysis into the IJA. We say that they have a higher chance. Why to give them, which increases the chance of delirium. You counsel the family members about high-risk emergency surgical procedures. The communication, the interpretation, and talking to the patient relatives, this skill empowers you to become the leader. And this becomes essential. When we have a lot of medical legal cases coming against doctors, I think this is the skill we need to acquire. If we can keep ourselves updated, if we have clinical and technical mastery, if we are critical thinker, if we take a correct decision and communicate to the patient, if we have these skills, I think that majority of those cases which are happening will not happen when we talk about those legal implications. So a skill, which is decision making and critical thinking, is the authority during crisis and trusted decision leadership in the perioperative care. It improves your intraoperative judgment. It makes you competent to anticipate complications. It gives you confidence under the stress situation of uneven thinking. Even there is a 5 liters of blood loss, you are confident you will be able to manage it. You get respect from the surgical team and the critical care. And finally, you provide safer evidence-based patient outcomes. And the skill, decision-making and critical thinking, which comes from various sources, this skill is an important aspect for anesthesiologists to acquire. Not very difficult, you can. When we say these skills, the communication skills becomes equally important because as an anesthesiologist, you have to communicate clearly with many stakeholders. Surgeons on one side, critical care physician, the team, the OT team, sometimes physiotherapists, dietitian, other people to prevent errors and strengthen teamwork. And this communication in anesthesiologist is not optional. It is a patient safety tool, a team leadership skill, and a professional marker. And hence, I personally think that the communication skill is one of the mandatory skills for all of us to acquire. Whether you are in OT, the ICU, the labor room, the endoscopy suite, the recovery bay, the OPD managing pain clinic or palliative medicine clinic, each place requires effective communication to multiple stakeholders. And hence, we have to acquire these skills as mandatory to empower yourself for various purposes. And when we try to acquire it, we have to think of patient counseling, empathetic preoperative explanations, breaking bad news for some complications, for some morbidity or mortality in the intensive care unit. We need to look for a perfect handover protocols, which is standardized so that there is no lab communication in handing over. And this improves collaboration with surgeons, nursing teams, and intensivists. And this skill, that's why becomes important from all us. And how can we do it? When we say you enhance yourself with this skill, you're managing patient, you reduce his fever, it improves compliance, build trust, prevents medical legal conflict, preserves dignity, prevents panic, prevents errors, and it builds respect and gives you a leadership role. So this is the advantage that you get when you learn those communication skills well into your clinical management in your professional practice. So once you acquire this communication skill, you provide better perioperative safety, fewer conflicts and errors, higher patient satisfaction, smoother teamwork and handovers, and strong professional perception. And that gives a lot of satisfaction to you because you are leading the team. And hence, the communication skills becomes important. Once you start acquiring the skills that we have just discussed, it automatically will take you towards the leadership and teamwork. And many anesthesiologists in India are already taking a leadership role at various capacities. So proud moment for us when the Indian anesthesiologist takes the highest seat. They are taking effective leadership roles. They are effective leaders and doing a lot of good teamwork. And this we all can acquire easily if we understand it. Because as anesthesiologists, we have a privilege to coordinate with many people. So what grades look like is probably when we try to coordinate critical events, train and mentors various people who are into our team. We develop skills in resource allocation. We know that which patient to be posted where. And we also facilitate interdisciplinary communication. We communicate between surgeons and critical care team. We communicate between acute and chronic pain physician team. We communicate between physiotherapists, dietitians, surgeons, and patient teams. So this means we as a leader, and nowadays many people do run PSC OPD clinics, prehabilitation clinics. And when we run those prehabilitation clinics, you are interacting with them and you take a leadership role for managing a patient. Nowadays, it's not the surgeons who has the admission rights, but if you see the other way around from the clinical aspect, the leadership role is already with the anesthesiologist taking care of patient from the preoperative optimization, so-called prehabilitation, to the post-operative period, which is called rehabilitation. And obviously, intraoperative period, we are doing a lot for these patients. I think this is what, when we try to take these type of roles, we coordinate critical events and emergency teams. And say, for example, if somebody has a massive hemorrhage, a difficult airway, I think we take a team leadership role and try to manage this. If we have expertise, which we mentioned initially, clinical and technical mastery, we will be able to manage, and your surgeons and your teams will be happy. You train and mentor readiness nurses, technicians, take classes for them. They will become fan of you. They will become good team member for you, and you'll be able to run it very well. Run the simulations, give them a micro teaching, give them a structured feedback, maybe in the OT, maybe in the simulation rooms, and then try to run it. Resource allocate. You can get your cases done. You can get maximum cases in a limited time. You don't have to waste the OT time. If you start doing it, obviously you become leader of the OT room so that you are doing resource allocation appropriately in those situations. And similarly, the communication between different teams, which I just mentioned, it will be again an important aspect. So this is the another skill which each one of us should acquire. It is a recognition as a system leader, not just a proceduralist. We are all proceduralists. It's a basic training. We know how to give a regional block, how to do a airway management, how to insert a central line. But we just not have to be proceduralist. We have to be system leader in which one component is doing procedures and doing these procedures without panic. And if you do it, many advantages. Fewer escalations, fewer call for help, better training, better team, higher operating room efficiency, lower frictions across the various stakeholders managing the patients. Now, another important part. This is a skill that we also need to learn. Sometimes we are happy to say, I have been doing it for last 10 years, 20 years, I'm happy with it. Why should I change? But then I say, think of your personal life also. Sometimes we say we are happy with 20 years for using this technique, though there is literature which says that technique needs to be changed. But even in a personal life, are we using the phones which were available 10 years back, the keypad phone? Are we using the vehicles which are not motored power? Now we have cruise control vehicles that we want to run. This means in personal life, we adapt the latest advancement into technology and we learn it. If new iPhone is released, people will learn how it works. They will spend some time reading it module, the insert that comes along with it. They will see YouTube videos and will learn within a couple of hours or maybe days or maybe sometime weeks, and they will be adapting to the new technology. This is also important to understand that this technological adaptability is equally important for anesthesiologists, and this skill also must be acquired. Medicine is becoming tech-driven now. We are having so many tools now. The simple ultrasound 10 years back has become AI-based ultrasound tools now. The artificial intelligence has been ingrained into medical science now. And I'm very sure that in next 2, 3, 4, 5 years, you will see a lot of technological changes being happen in the perioperative medicine also coming up, which will predict the hypertension. We have a cardiac output monitor which can show you the right path. People are making video laryngoscopes which will identify the correct place. So this means we have to adapt the right tools, use them well, and make them routine. And we need to acquire this skill of technological adaptability rather than saying that we are okay with older tools. Why not to adapt it into our clinical life? We have to master AI-based monitoring and prediction tool. We have to master point of care devices, whether for say regional blocks, whether for vascular areas, vascular line insertions, whether for airway management, whether for coagulation abnormalities. So we have to embrace electric and medical records and digital documentation so that we can do a better data collection, better research, and engage with tele-ICU, tele-perioperative system management. And this technological advancement will be coming big way in next coming few years. And as a leader and as a person, we need to acquire this skill again for the technological adaptability into our science. The AI-based monitoring and prediction is coming a big way. We now have extubation risk flags. We have intraoperative hypotension prediction tools available. So this will be coming up. Point of care ultrasound, ABG, ROTEM, handheld ultrasound, gastric ultrasound, all those things are being used very effectively now, and we have to be using them. Electronic records, tele-ICUs. So this means the future ready practice and improved efficiency lies on our adaptability to these technological advancements. If we acquire this skill, we will be able to have fewer adverse events because we'll be able to predict through earlier warnings of the complication which are going to happen in a patient. We have faster data-driven decisions at bedside because we are using technology and can take better decisions. Cleaner documentation and easier audits, research, and lesser amount of medical-legal aspects. Safer handovers and better reach to peripheral centers and night cover when we start using these technology like tele-ICUs, tele-PACs, and other aspects. Now, another skill which all of us must acquire apart from academics is research. Sometimes we say that I am not a researcher. I'm a clinician. Why should I do research and learn that? We should also learn the research into our clinical practice because contributing to knowledge elevates your standing and sharpens your intellect. We have to be from knowledge consumer as a simple person to a knowledge generator. And this is what we have to share our experience in the form of research. And once we become a knowledge generator, with time, we become a knowledge leader. And this is what is acquired. And this is what skill is important. You may not be doing a lot of extensive research at some point of time, but you will be having a lot of experience, which you can always share in the form of research. And that is what you have to become a knowledge leader, not a knowledge consumer. And if you can do it, not only your patient improves, but this skill of doing research and academics will make you global leader. And this is what we need to acquire. And how can we do it? You can participate in clinical trials, multicentric research, publication in journals, attend conferences, mentor students and fellows in scholarly work. And if you do it, you become a great academician. When you do a studies, multicentric studies, you can have new devices, new experiences. Your experience is published, which you have been doing so for so many years, gets validated and becomes a standard of care, becomes a new tool for others to manage it. If you publish in journals, publish your papers like Indian Journal of Anesthesia or many journals which are coming from India and across the globe where you can use them. So when you do it, it sharpens or shapes the scientific discourse, enhance your credibility that you are doing this work, which is very well accepted globally. When you don't publish it, it is locally credible. When you publish it, it becomes automatically globally credible. And that's why it leads to you an academic leadership. When you attend conferences, whatever it is, ISACON, IDA, WFSA, ASA, you acquire knowledge from other peer colleagues also. They must be doing some good work. They must be having some good experiences. When you share, when you interact, when you network with them, you learn a lot and you become a better person. When you mentor students, when you teach somebody, we also learn. If I teach somebody, I will also refine my knowledge. I will also read more. And that's why mentoring students and fellows is very important. So acquire this skill of research and academics because it enhances the national and international visibility. It makes you an academic leader. And obviously, the career advancement is a side effect of it. I say side gain of it, not side effect actually. And once you do it, your scientific credibility and thought leadership becomes better. You are an international collaborator. You create more evidence for safer patient care, growth in reputations, awards, and recognitions, and you inspire your next generation to do the same. And you become a leader, a path giver for others. And that's why this skill becomes important to acquire. The other skill, well-being and emotional resilience. Whatever I've said till now, you can acquire when you are maintaining yourself in the ambit of a well-being anesthesiologist and emotional resilience. Because a burnt out anesthesiologist can't do all those things which just mentioned. So we have to protect the clinician to protect the patient actually. So this skill has to be acquired by each one of us so that whatever skills I have talked earlier, they can be acquired, maintained, upgraded, and updated. How can we do it? Stress management, self-reflection, healthy boundaries, seeking help for burnout, peer support system, getting your hobbies, enjoy what you do. And once you start doing it, whatever way you walk, cognitive offloading, after action reviews, this is another important thing. When something goes wrong, discuss, self-reflect, what to do next. Sometimes, say, at certain point of time, you have to take a break. If you think you are burnout, discuss and try to take a break. You just have a weekly checkout for something so that you have a good sleep, good time for yourself, and you are able to manage it. Peer support system, have a good friends, go to a teamwork, go to conferences, networking, enjoy. And this is what we needed. This skill again needs to be acquired by us because if you really want to give a sustainable performance and long-term career satisfaction, this skill becomes important. And when you acquire it, there are fewer errors from cognitive overload and fatigue. There are smoother communication and calmer crisis responses, more sustainable careers, better teaching presence, and higher patient satisfaction. And finally, when we go all those skills, we automatically become administrator, leader. This task rules automatically comes to you. You are shifting from executor to influencer. Now people say social media influencer. Same is the anesthesiologist influence. Moment you are a team leader in the OT, you automatically will given a higher administrative role. From running a case to running the system is what you can easily achieve while acquiring the skill. Yes, at certain stage, you will be running a case, getting a case done. But then if you acquire the skill, acquire some attributes, you will be running the system whole. And you can grow by having your quality assurance, participating in policy making, SOPs, engaging in scheduling, staffing, and plannings, and taking in part in hospital committees, audits, society work, so that you become a good administrator and you can take a leadership role. And you can easily do it. Many of us are already a part of it. The moment we start participating in NABH, JCI accreditation protocols, we understand. Many of us has worked in the COVID times in various national and international policies. We are also part of the OT charges involved into many purchases and those communications. We are also interdisciplinary communication and committee works with regards to infection control committees, with regards to the purchase committees, with regards to the patient safety audits and other aspects. This again adds on. So with these all skills, you should also acquire this skill because it will have an institutional influence. It will give you a leadership credibility and you can provide a better workplace system. And once you do it, at whatever capacity, there will be fewer escalations of various interventions, better training skill acquisition, higher OT efficiency, and lower friction. And that is what your leadership roles are there to manage them. So try to acquire those skills, whatever it is possible for you. Maybe sometimes we may not be able to excel in all, but with time, we can always shift from one gear to the other. As we run a vehicle, we never always go to the fourth or fifth gear in the initial beginning, but always we start from first to second, second to third gear when the cars takes a speed. And that is what, when we say acquiring skill, which we have just discussed, we can always make you gear up so that you can step up the ladder, acquire those skills and provide and make yourself empowered for this self-driven skill growth. And each of you can do it. Anesthesiologists are not longer just OT doctors. We are perioperative physicians. ICU experts, CPR experts, airway warriors, pain specialists, researchers, leaders, administrators. We are as anesthesiologists. And when we start doing those things, we command respect, lead teams, innovate practice, stay future ready, serve patients, and grow personally and professionally. And this is what, when we try acquiring these skills, we'll be empowering ourselves for all those skills and can take various leadership roles at various platforms. I'm sure that each one of you will be happy to take these skills subsequently forward so that you start enjoying not only your personal and professional growth, but also you're providing a society, a community, better livable place from both personal and professional front. Thank you so much.